Hi, good morning. My name is Alan Saraf. I'm Chief of Pediatric Cardiac Surgery in Hadassah Hospital. I started my career more than almost 40 years ago. I did my rotationship in the specialization in cardiac surgery and pediatric cardiac surgery, Paris, France. And I had also a fellowship in the United States in Boston Children's Hospital. And then I was offered the job in Hadassah, which is very close to my house. And I accepted now about 3 years ago. I'm now working in Hadassah Hospital. So altogether, you ask me how many procedures I've done in my career. I would say then approximately more than 15,000 or 20,000 cases. Generally, pediatric cardiac surgeons are doing surgery on bypass, of course, and a lot of surgeons around the world are working with hypothermia. I mean, they reduce the core temperature and to protect the brain, the bodies, and everything. The problem of this technique is that there is side effects on hemostasis, on recovery, inflammatory system, everything. So with time, we developed an approach, a different approach that 99%, I would say even 99.7% of our patients are completely done on a normothermic cardiopulmonary bypass, even aortic arch repair, even total veins. All of them we are not cooling these patients, so we avoid all the side effects. And we have conducted some research on that, and we have demonstrated that the recovery is better. We have demonstrated there is less injury to the whole body cells. We have demonstrated that the brain is well preserved, and this is the way we are doing. All our patients are done on normothermic surgery. This is point one. We have developed techniques that avoid useless acts during surgery. For example, the case I have I like to mention is that generally, if you go to the operative report all around the world, patient is undergoing an arterial switch operation, you will find that cross-clamp time, you know what is cross-clamp time? Is the time that the heart is arrested during surgery. Cross-clamp time is in between 1 hour and an hour and a half. I mean, the ischemic time of the heart is an hour and a half. And with our technique, we avoid useless procedure during this. So we have reduced this time to 30 minutes. I mean, half an hour of ischemic time. And 1 hour of cardiopulmonary bypass instead of 3 hours. So we reduce the ischemic time, we reduce the inflammatory response to cardiopulmonary bypass by shortening the time of the procedure, by normothermia, and we can testimony today that the postoperative course of this patient is very simple. With regard to results of our work, let's say that we can divide it in immediate results and long-term results. Immediate results, we can split it in what we call the mortality and morbidity. Mortality is very low. It's about 1% or even less than 1% of the patient. We didn't lose any patient from transposition. All the transposition was 100% survival. Tralogy follow 100% survival. AV canals about 98% survival. altogether, I can say, and I'm doing quite a good follow-up on the patient afterwards, they are doing extremely well.